This is Unit 2, Behaviors for Success, and in mini lecture 2A, we'll be covering part of Chapter 12 on lifestyle management. Wellness is largely under personal control, but not completely. But we will be focusing on the personal habits that help lower your risk of non-communicable diseases. And it is true, it is a personal responsibility. There are many, many social determinants of health, however, that impact these diseases as well. Now, as far as healthcare workers, it's extremely important that you practice good health habits. This is to keep yourself healthy. Health careers are not easy careers. You need to be strong and well, and it's also to be a role model for your patients. So when you talk about habits and health, it's important to note that change is not easy and that little small steps of change make a big difference. Here are some guidelines as far as making changes. So things like being patient with yourself, being reasonable, being positive, tracking progress, planning rewards, all of those things are important. This chapter devotes a good bit of time to diet and nutrition. It reads like a mini nutrition textbook, so you'll be introduced to a lot of terminology. And I won't cover all of it in detail, but you certainly should, because your exam will cover these terms. When we talk about nutrition, the base word is nutrient, and these are the 6 classes of nutrients. Water makes up more than half of the average adult's body. True or false? It is true. Which of the following classes of nutrients provides the body with immediate energy? So which class of nutrients is for energy? Carbohydrates. Which of the following vitamins plays an important role in preventing infection? Vitamin A. A lot of people would say vitamin C, and vitamin C is important for the immune system, but not as much as vitamin A. When you're deficient in vitamin A, you're much more prone to have problems with infections. Which of the following vitamins does the body need to absorb calcium? This is very important. It is vitamin D. So be sure to read over the information very carefully, take notes, make note flashcards as well. You'll also be introduced to fiber. Fiber is the part of plant foods that can't be digested. It's important for healthy bowels, but more than that, it can also decrease the risk of a number of chronic or non-communicable diseases. And calories aren't something you can hold, they're a measurement. So they measure the energy that food can provide. And you see here that fats, even the healthy fats, are more calorie or energy dense. In nutrition, when we speak of energy, we're referring to the fuel that we find in food. Be sure to understand the types of carbohydrates, because carbohydrates can be very healthy for us or very unhealthy for us. And your text does describe which is which. Okay, we shouldn't be saying, I need to cut down on carbs, because fruits, vegetables, whole grains, legumes, they are carbohydrate foods and they're extremely good for us. We need to cut down on sugars and refined grains, perhaps. Yeah, sugar is the worst ingredient in many American diets, and it adds calories, not nutrients. Not only does it increase your risk for a number of chronic diseases, it can increase the unhealthy fats in your bloodstream. When we look at fats as well, we need to distinguish between healthy fats and less healthy fats. So a diet that is moderate in healthy fats is perfectly fine. And you see a number of those healthy fats on the image on your screen. A diet high in unhealthy fats, and there are things like fatty meats, cream, butter, cheeses, these can cause health issues. Cholesterol is produced by your body, and even though it's needed, you don't need it in your diet. When you have too much cholesterol in your bloodstream, it can lead to plaque in your arteries or a gunking up of your arteries. When you have too much trans fat, saturated fat, and sugar in your diet, that can increase the cholesterol in your bloodstream. Now, I've generalized because whether the cholesterol builds up in your arteries depends on how it's traveling, the type of cholesterol. So LDL cholesterol contributes to plaque, and HDL cholesterol clears away the cholesterol from the artery walls. LDL, lousy, HDL, healthy. Trans fats are the worst fats for you. Trans fats are mostly found in processed foods, so they're added to our food supply for the most part, although some are found naturally in foods, but very, very little. Because trans fats raise cholesterol so much in our bloodstream and the bad type of cholesterol, many states have banned trans fats. Many manufacturers have stopped using it. Many consumers are aware it's a problem. Sodium is also something that's abundant in our food supply. A little salt is necessary to the human body, but we get much, much more than we need, and that can contribute to high blood pressure, to damage to our artery walls, to the consequences of high blood pressure like stroke and heart attack. The amount of salt that's recommended is 2,300 milligrams per day. Okay, 1,500 is even better, but 2,300 milligrams is about a teaspoon of salt. But keep in mind, we don't add most of our salt to our food. We get it in the restaurant food and the takeout and the processed food. Processed foods tend to be very high in added sugars and salts. Not all, and there are exceptions to the rule, but what are called ultra processed foods are extremely bad for our health. And unfortunately, Americans consume a lot of ultra processed foods. Now, one way to learn more about the food you're eating is to understand what you can find on the food label. So, the Nutrition Facts panel is found on most packaged food products. And you can note not only a suggested serving size, but also the calories in that serving size, along with a number of required nutrients and the amounts, again, in that serving size. So I am not sure what this food is. I would have to study it to guess, but let's say that it is some cereal product. Okay, this means that in 2/3 of a cup, there's 160 milligrams of sodium. In 2/3 of a cup, I get 4 grams of dietary fiber. Now, the percent daily value shows you how those numbers compare to what you're allowed or recommended in a day. If you use the 5 and 20 rule, 5% or less is low, so this is relatively low in saturated fat. 20% or more is high, so this is relatively high in calcium and iron. What is the daily adequate intake of sodium? This is a little bit of a hard question. It's 1,500, but the upper limit or the dietary guidelines recommendation is no more than 2,300. A lot of consumers are showing more interest in organic foods, and there's good reason for that, probably in a couple of areas. One is for the environment, the other is for the consumer. There is research to show that high amounts of residues of agricultural chemicals, agrochemicals, can cause some health problems. So many individuals are looking for foods with less of those substances. Now, not all studies agree. Some research shows that organic foods are higher in nutritional value. Other research finds no difference. However, what's important to note is even if organic foods are no higher in nutritional value, they tend to be lower in chemical residues, and that's a concern. The problem, of course, is that organic foods are significantly more expensive. So, they're out of the price range for a good number of consumers. Yes, they are more expensive. And I'm not discouraging organic foods. Environmentalworkinggroup.org, EWG, has a list of foods that you should look for in organic form and those that you do not need to because we peel the skin or they have a husk, something that protects you. So if you're trying to figure out how to fit organic foods into your budget, you can look at ewg.org. So this is what healthy eating looks like, probably no surprise. This is a model of healthy eating called choosemyplate.gov, and it attempts to show consumers that when you look at a plate, we really need only to devote about a quarter of it to the meat, fish, poultry. The rest should come from plants and about half from fruits and vegetables. There you go. Now, there are other diet models out there. The Mediterranean is one of the top. Lots of studies coming out on the Mediterranean diet and how healthy it is, how it lowers your risk of a whole lot of diseases, can help you lose weight. You can do a little research on the Mediterranean diet. It looks a lot like Choose My Plate, tends to be even higher in plants, lower in red meat, higher in fish, more olive oil. So there you see some of the principles behind it. Okay, so a little bit about weight. This is an area where we're not doing too well in this country. 70% of Americans are overweight, 40% have obesity, and this is impacting children as well. Do overweight children tend to become overweight adults? Yes, they do. Okay, so when we look at the consequences of excess body weight, we can see a number of health problems, and that really is our concern, that we need to make sure people stay healthy and lower their risk of disease. So there are a whole lot of health problems that occur when your weight becomes too high. Now, we talked about the importance of personal responsibility. I'd like to say that there are many problems with our society that make it extremely difficult for people to stay healthy. And a few are listed here. We refer to these as social determinants of health. And many individuals don't have a lot of control over some of these social determinants. Notice also that genetics and hormone problems come into play, medications as well. So there are many causes of this. We measure your risk for health issues due to weight through something called a BMI, a body mass index. And it's not perfect. In fact, it's far from perfect. People who are muscular or have heavy, dense skeletons tend to have a higher BMI, so it doesn't work as well for them. But we use it quite a lot in healthcare, so you should be familiar with it. There are a number of calculators online, so you can calculate your BMI. It's meant to be a red flag, not a perfect indicator. So if your BMI is 30 or higher, that you should perhaps take a look at whether you have some concerns or should have some concerns about your weight and about your health. So some detail about calculating this. If individuals need to lose weight for health reasons, there are many weight loss diets out there, but you need to be extremely careful in choosing a program to follow. You want to make sure that you're not punishing yourself, that this is a long-term lifestyle change, and that the diet is a healthy one. Vegetarian diets are an option, and when well planned, they are one of the healthiest types of diets in the world. Plant-based is moving towards a vegetarian diet. Now, a vegan vegetarian diet is only plant-based, and lacto-vegetarian is plant plus milk. Lacto-ovo, throw in the eggs, and flexitarian, some animal products. So flexitarian is more a plant-based diet as people typically refer to it. Is it impossible to get enough protein? That is false. There are so many sources of protein in plant foods. So, a quick look at eating disorders, something that we certainly don't want to cause by focusing too much on body image, body shape, body size. Remember to focus on health when you're talking about things like changing the diet. These are the three major categories of eating disorders. These are psychological entities, and the chief professional working with the patient is the psychologist, psychiatrist, or counselor. Okay, so move on to the response.